His Excellency Muhammadu Buhari.
Emmanuel Macron, President of France, Hasina, Prime Minister of Bangladesh, Your Excellency Kamala Harris, Vice President of the United States of America, Mr. Pascal Lamy, President of Paris Peace Forum, distinguished ladies and gentlemen, I thank President of the Paris Peace Forum, Mr. Pascal Lamy, for the invitation to share my thoughts on the importance of coordination among all actors in the fight against coronavirus pandemic. The coordination has to be total, and the objective has to be same, to deliver vaccines to the world. The state of vaccine delivery across the world leaves much to be desired. We have a situation where some countries are giving booster third doses for their citizens, when millions across the world, especially in the developing world, are yet to receive a single dose. Let us compare vaccination rates to give you an idea of the dimension of the problem. According to recent data, as of 4th November 2021, 91.3 doses of vaccine had been given for every 100 persons across the world. On the same date, however, only 14.7 doses of vaccine per 100 persons has been administered in Africa, a clear case of lopsidedness. According to Bloomberg, countries with the highest incomes are getting vaccinated 10 times faster than those with the lowest income. As of 5th November 2021, Africa had fully vaccinated 70 million persons, amounting to just 6% of the continent's population. By comparison, 60% of the European Union population had been fully vaccinated by September 2021. This massive gap between vaccine requirements in Africa and vaccine availability is undermining the fight against coronavirus pandemic in the continent. Even if Africa were to receive the 600 million doses of vaccine expected to be delivered to the continent by end of 2021, under the COVAX arrangement, there will still be a considerable shortfall when compared to the population of the continent, which currently stands at 1.383 billion. According to the World Health Organization, even the planned COVAX deliveries to Africa have been cut by 25% due to supply shortages and export bans. This is a major setback for Africa, where it is estimated that coronavirus vaccine deliveries have to increase from around 20 million doses a month to an average of 150 million doses a month if the target of fully vaccinating 70% of its population by September 2022 is to be achieved. So what needs to be done to plug the gap? How can vaccine availability in Africa be boosted? Who needs to do what? Export restrictions that encourage needless hoarding of vaccines need to be lifted. We welcome the pledges by industrialized countries to share vaccines, but they should be fulfilled in a timely manner. We thank countries such as France that have donated vaccines to developing countries. Resolving supply chain constraints will require better coordination within the manufacturing process and between manufacturers and end users. There is a clear need for the expansion of vaccine production capacity in Africa. In this regard, African countries already have a roadmap. The pharmaceutical manufacturing plan for Africa, developed in 2007 by the New Partnership for Africa's Development on the basis of an African Union Summit decision taken in 2005. Licensing agreements should be reached with pharmaceutical companies for the transfer of intellectual property and technology to support the production of vaccines in Africa. If global vaccination is the only way to end the coronavirus pandemic, then all stakeholders must act in coordinated manner to plug the vaccine gap in Africa. I thank you for your attention.
President Buhari, thank you so much for those words, and that go to the heart of so much of what we're talking about.